Octopus! Welcome to Platinum, where future top-notchers are made. I'm Lara, and join me as we make our journey to Top 1. I'll be guiding you through today's topic, lipid-related disorders. This session will help you understand the different ways lipids, or fats, affect your health. By the end of this session, you'll be able to identify and describe at least 5 common lipid-related diseases, explain the biochemical basis and pathophysiology of each condition, discuss relevant diagnostic laboratory tests used for detection and monitoring, interpret sample lipid profiles and relate them to disease conditions, and lastly, apply knowledge by solving clinical case scenarios related to lipid disorders. Before we dive in, let's do a quick check. What do you already know about lipids? Can you name any? Now here's a question to think about. Are all fats bad for the body? You might be surprised. To help us, let's quickly recap. Now, lipids are fats and fat-like molecules. They are essential for our body. They store energy, form cell membranes, and help produce hormones. But as you'll see, having too much or the wrong kind of lipids can lead to disease. Let's bust a common myth. Not all fats are harmful. In fact, some, like omega-3 fatty acids, protect your heart. Others, like saturated fats and trans fats, can raise bad cholesterol and increase your risk for disease. We'll go over these differences today. Lipid-related disorders are conditions caused by abnormal levels of fats in the blood, like high LDL or triglycerides. These can develop due to poor diet, lack of exercise, genetics, or medical conditions like diabetes. These disorders happen when the body can't properly process or regulate fats, leading to buildup and damage in organs and blood vessels. Let's begin with atherosclerosis, a condition where plaques made of cholesterol and fats build up in the arteries. Now this buildup narrows your blood vessels, making it harder for blood to flow. If a plaque bursts, it can cause a blood clot that may lead to a heart attack or stroke. LDL cholesterol, also known as bad cholesterol, is the main culprit here. It delivers cholesterol to your tissues, but too much of it builds up in the artery walls. Moving on to hyperlipidemia. This refers to high levels of lipids in the blood, especially LDL and triglycerides. It's often symptomless until it leads to complications. Now, some people have hyperlipidemia due to poor lifestyle habits, while others inherit it. Familial hypercholesterolemia, for example, is a genetic disorder where the body cannot remove LDL efficiently. This leads to very high cholesterol levels from a young age. Next is fatty liver disease, also called non-alcoholic fatty liver disease or NAFLD. Now, this happens when too much fat in liver cells. It's linked with obesity, diabetes, and high triglycerides. Now, most don't feel symptoms at first, but over time, that untreated scarring called cirrhosis. Now, that scarring prevents the liver from working properly. Metabolic syndrome is a group of conditions that increase the risk of heart disease and diabetes. These include increased waist size or abdominal obesity, high triglycerides, low HDL or the good cholesterol, high blood pressure, and high fasting blood sugar. Now, if you have 3 or more of these, you may have metabolic syndrome. Now, let's explore rare inherited disorders. Tay-Sachs disease happens when the body is missing an enzyme called HEX-A, leading to fat buildup in nerve cells, especially in the brain. It's most often diagnosed in infants, and sadly, there's no cure. The child usually doesn't survive past early childhood. Gaucher's disease is caused by a deficiency of the enzyme glucocerebrosidase. Fatty substances build up in organs like the liver and spleen and can also affect bones. Thankfully, This one has treatment options such as enzyme replacement therapy. Let's now talk numbers. Lab values from a lipid profile test. These help us detect risk early. Total cholesterol should be under 200. LDL, or the bad cholesterol, should be under 100. HDL, or the good cholesterol, should be over 40. And triglycerides, they should be under 150. HDL helps clear cholesterol from your bloodstream. LDL, when too high, causes plaque. These numbers tell you if your lipids are at healthy levels. Treatment and prognosis vary by disorder. Some can be managed with lifestyle changes, while others need medication or specialized care. Atherosclerosis is treated with statins, which are cholesterol-lowering drugs that block an enzyme your liver needs to make cholesterol. Surgery may also be needed in severe cases. Hyperlipidemia is often managed with a better diet, regular exercise, and lipid-lowering medications. Prognosis is good if controlled. Metabolic syndrome is managed through weight loss, blood sugar control, and dietary changes. Fatty liver disease is improved with a healthy diet and avoiding alcohol. If caught early, it's reversible. Tay-Sachs, sadly, has no cure, only supportive care. Prognosis is poor for the infantile form. Let's apply what you've learned. Meet Anna, 45 with a sedentary lifestyle. Her labs show high triglycerides and low HDL. She doesn't have symptoms yet, but she's at high risk. Now her profile suggests metabolic syndrome, which is a serious red flag for future heart disease or diabetes. The doctor advises Anna to switch to unsaturated fats, exercise regularly, eat more fiber, and cut down sugar. With these changes, Anna could lower her risk significantly and possibly reverse her condition. Here's another case. Mark here is 6 years old. He often complains of bone pain, and tests show an enlarged liver and spleen. These are signs of Gaucher's disease, which is a rare genetic lipid disorder. A deficiency in an enzyme prevents fat breakdown, causing buildup in his organs. Mark is started on enzyme replacement therapy. Early diagnosis gives him a better chance at a normal life. Quick review. Which lipid helps remove cholesterol from your blood? You can pause the video and think. HDL, the good cholesterol. HDL sweeps up excess cholesterol and returns it to the liver. Now, how do you keep your lipid levels healthy? Here's your checklist. Eat healthy fats like nuts, avocado, fish. Next, avoid processed sugars and trans fats. Exercise at least 30 minutes daily. Do not smoke. Lastly, monitor your blood lipids regularly. To wrap up, lipids are vital, but too much of the wrong kind causes harm. Learn your numbers, know your risks, and act early. Now you can check the quiz linked below and reflect. What change will you make today for a healthier tomorrow? Thank you for listening to this lesson.